Hello everyone, welcome back to my show. This is NainaMD, Beverly Hills Fusion of Science and Beauty. And I have an amazing guest today. He is double board certified plastic surgeon. You can't get any better than that. And right here in Beverly Hills. Very well known, Dr.Kamar Dhir. How are you?
Thank you for having me back. Thank you so much. Doing well.
He has come to my show before. I hope you guys had a chance to see him. We discussed eye rejuvenation, fabulous discussion we had. And today I want to talk about nose and nasal reconstruction because so many people, as you know, are having sinus issues, right? They're having allergies, sinus issues, and sometimes a deviated septum. It's not just for cosmetics,
Correct.
You know, that people get surgery to the nose done. And I think it's so important for if you could just go through with what really what we could say a nose job, okay, is really all about, and what we can achieve, and what is the latest greatest in terms of the anti-aging regenerative movement. What are the advances that we've made in nasal, you know, in the nasal reconstruction?
That's a great question.
Yeah.
Yeah. Well, in anti-aging and this new world of exercise,
I
yoga, and this thought that breathing is so important for sleep, for exercise. Nasal breathing has become on the forefront of just the actual functionality of the nose. And with that comes chronic sinusitis can also make breathing bad. So
how many people do you think? There's a lot of people that are affected, right?
Oh, and especially in this country when there's not many windows that are open or circulated air.
And we're getting into a very toxic environment, and just so much we suffer.
Yeah, and nasal breathing is really in the forefront of improving someone's breathing is through having a functional nose.
Right.
And so the latest and greatest now is actually putting beauty and function together. So deviated septum, as we can call it, is simply the nose is on the inside crooked. Then also there's external factors if you have collapse of the nose. So function to make a nose structured so it breathes well also has to look good, natural, and harmonize with the rest of the face. So the latest and greatest now is going to surgeons who believe in form and function, and that's very important.
Yeah. And for those of you who says he's looking really young, he looks super young, but he's in practice for a long time. Really, years and years and years.
It was a nasal surgery I had.
You do not have one wrinkle on your face.
Thank you very much.
So, but what's the first thing like that you see in terms of when you have in nasal reconstruction? What would you say the first the driving force behind the patients that you get?
I had two types of patients. Number one is someone who can't breathe, and based on their nasal exam is that they need a functional nose as well as an improved sense of the nose, how it fits with the face. And then there's the cosmetic patient who just wants cosmetically to fit with the face. But both patients deserve a great evaluation and a functioning, natural appearing nose. So people don't look at the nose, people should just look at someone's eyes. That's the most important to me, is someone should look at the eyes and never say you have a perfect nose. That's not what you want. You want a nose that harmonizes with everything.
I love that. I love that because I think that is so, you said it, so much of the, so many times, sometimes if there is a nasal reconstruction done for cosmetic, it's like the focus is so much on the nose, and it's the eyes. You're absolutely right, it's the eyes. That's a true sense of beauty, and the nose should just sort of blend in and just say, hey, this is just like, everything just looks very symmetrical, very just blended. And then you can focus absolutely on the eyes.
And if it functions well, meaning the patient breathes better, is able to sleep better. Snoring can often be improved, not always. And also the more you sleep, better exercise, you do look younger, and then that with what you do when I send patients to you is the anti-aging portion of once they have that exercise improvement, they're on their way to looking and feeling younger.
Absolutely. What is, in terms of, tell about the surgery, how long is generally the surgery? And then after, are you like, is there bruising around the eye area, or how long does all that take? I know you have to have nasal packs and so forth, and is it usually about like a week or two?
Yeah, you want to customize the nasal procedure for every patient, but in general, the surgery itself can take anywhere from 2, 3, or 4 hours. Patients under general anesthesia in general, and the patient comes back in 1 week, and the cast and any kind of splints or any kind of packings, which are very minimal, come out. At the 1 week mark. Bruising is very minimal. Expect some bruising around the eyes, but in general, over the years, I've seen that I get less and less and almost nothing, and usually it's all gone by 5, 6, 7 days.
Usually it's all technique driven, because if you're getting less and less.
We like to say so.
That's great. Listen, I know that we've, like the last year we talked about all the eye rejuvenation. I know we've touched on the nasal, but I want to ask you something personal.
Oh, great.
I want to know how do you take care of yourself? You have to tell me what time do you get up, and then what do you eat? I want to know everything. I always ask this a lot of people because I'm a fanatic about what people eat. So this is like, okay, you guys, this is a confession. Oh,
So the truth has to come out.
It has to come out.
It has to come out.
So when you get up, what do you eat?
Well, the truth has to set me free. I
Yes,
believe, right?
you have. Yeah.
I have to be very honest. I have a 4 and a 2-year-old, and so
Yes.
running after them is where I get most of my exercise.
Wow.
But in general, I always tell patients, try. And I have to admit, I try. We all want to have a diet, a good diet. We also all want to have a good exercise program, and we want to feel good
So what do you
about
get when you
ourselves.
get up? What do you do?
So when I get up, it's
Yeah.
always like 2 glasses of water first, and some
Perfect.
orange juice, and my vitamins are things that you've recommended.
Yeah.
Then you try. Breakfast is supposed to be the most important part, but when you're waking up at 6 a.m. for surgery,
Okay, yeah, you're
I
not-
often don't get a breakfast, and I'll be honest about that.
Yeah.
But my kind of the reason I feel good is that I would like a better diet exercise program. However, what works for me is that when I eat a meal, I do eat what I like and don't stop myself, but I don't snack. I never eat sweets in between meals. I never eat snacks. Even if someone brings in something to the office, I usually don't have anything between meals.
Yeah. How much water do you drink?
I am, depending on my day and my throat, you like to get 8 glasses of water.
to try to get
I get about 3 or 4.
4, okay,
Yep.
okay.
And then running behind my kids always helps, and then playing tennis. And then,
That's your hobby?
That is,
Tennis?
yeah, as much as we can get that in.
Fabulous.
But running after a 4-year-old and 2-year-old, a gymnastics class can kind of give me my exercise.
I can imagine. Yeah, I know when my kids were little. What do you like? Is there something that you absolutely like in your mind say, I have to do this on it, like your 2 glasses of water, okay? Is there something else that you do that you're just like, okay, you're like totally sort of like obsessed about that I have to do this to stay healthy? Is there something in your mind that you absolutely have to do? Give me that secret.
That's
I
a
want to
great
know your
question.
secret.
My secret.
Because you don't have one wrinkle on your face. The audience wants to know.
I think it is to feel good about yourself, and I think the one thing I really make sure I do is that I connect with friends and family. I'd spend time with interacting with friends and be able to laugh, have fun, and talk about what's on your mind. I think the most important about me are my relationships.
So it's really your energy, right?
And how
So
you
it all
feel about
comes back to
yourself
that's how you
connects to
yeah,
exercise,
yeah.
food. If you don't feel good about yourself, you're not going to go interact with others. So for me, I do everything I can to feel happy so I can be around and interact with people. That's where I get my youth and strength.
So now I'm going to ask you the next question. As a plastic surgeon, okay, we have estheticians who give their opinions. I, as an anti-aging expert, have my whole take on what are good topicals.
Yep.
What are like some of the latest, greatest, the rejuvenate anti-aging, regenerative medicine? What are your like top picks for like or ingredients for like giving that people should absolutely be on in terms of creams or maybe eye creams or whatever?
Well, I know in your background you've had a significant amount of history in the anti-aging of topicals, and so I don't have a favorite. I always go with what's the science.
Do you like vitamin C, topical vitamin C?
Absolutely. Anything that can give the skin a chance to regenerate more volume, which is collagen and elastin, which is the two top
build that
eggs.
up, yeah.
And so those are vitamin
acid,
C.
Hyaluronic acid, which builds up amazing volume. And I always touch on it. There's like low and medium and high molecular weight, and as you get the low, it goes right more into through the dermis. The high will stay and plump the skin up. So I mean that's an amazing
and that's the
ingredient.
science. And anything that can help those factors, your normal body to heal itself, those are the best things. So there are ultrasound machines, there's non-surgical options, there's laser.
Do you have lasers? Do you have
yeah, we have
lasers?
Ulthera. Ulthera is an ultrasound to help thicken the skin and give a skin tightening or a lift.
Yeah.
There are lasers.
You like that one?
I think it's good for the right patient.
Yeah.
You get about 10 to 20% of a facelift experience.
Fabulous.
But there are topicals that you want, vitamin C. There are retin A, hydroquinone, things like that help to regenerate the skin. But the point is to meet with a professional and think about options and get something that has science behind it.
Absolutely.
Yeah.
What in terms of there's for example, last time we hit on the rejuvenate, we've got Latisse, which can build up. Now hair loss is a huge thing. So as a plastic surgeon, do you get like where people come to you and say, look, I'm losing my eyebrow hair, or I'm losing my eyelashes, or I'm losing my scalp? Have you touched on any of those treatments in terms of scalp?
Yeah, and I think that the anti-aging whole discussion goes with youthfulness and hair.
It's huge.
For men
we are seeing
and
so
women.
many women and men losing hair, and all. I mean, I have a spiel on that, but
and I'm sure you have a scientific reason for it more than mine.
But you're seeing it, right?
Yeah, we're seeing it, and every patient, even though we do the nose, we do the eyes, but then they say, but my hair is thinning, or my forehead is getting enlarged or elongated. I think hair is a big topic right now, especially for men, for their confidence, appearance, for how youthful they feel inside.
Yeah.
They fixate on it. And women as well. Of course,
Yeah.
it's a little bit more rare for women, but it happens.
Yeah.
So let's just start with the eyelashes. Eyelashes is such a great option. We have Latisse now, which is just a topical.
It's amazing.
And over the 1 month to 4 months, you get these elongated lashes that are yours. They're thicker and they're yours. You stop using it, they go away, the risks are low.
It's a lot better option than the hair extensions. I like anything that promotes your own body to produce, right?
And I've seen a lot of allergies that come with the glue. Obviously, the better places are going to use a different type, but I have seen that there's responses to the glue itself. You can also use it on eyebrows to grow.
I was just going to mention a couple of it. Just put a little bit on the eyebrows is phenomenal.
Right.
Yeah.
And make sure it doesn't drip because you can't get
touch,
it.
isn't it? And it's just a great touch. Like right after you've done the eye rejuvenation, suddenly you've got the hair all around. I think that's very important to mention. You'll be able to stimulate the hair on the eyebrows. Even with the endoscopic eyebrow lift, you've got now the beautiful hair coming back. You've got the hair on the eyelashes. You touch it off for a woman with mascara, and it's just a win-win situation.
Yeah, we call that the topping. So you do a liquid facelift versus a faceless versus Ulthero. Anything we do around the eyes and the face. Longer eyelashes always helps with bringing a little beauty to it. It has not been utilized for obviously the hairline as much, but that's the next thing. I'm not a specialist in hair restoration, but it's a very big topic now, and I think that in your field, with your therapy, possibly that could be the generation of how we can stop hair growth. So I'm going to leave that on you for our next segment.
Absolutely. Listen, I'm so glad you came on again. I'm really, really delighted. And you are going to be one of my regular guests. I don't know if you knew that, but you will come on again.
It would be a pleasure.
Tell me a little bit about your website, how people can look you up right here in Beverly Hills.
The website, we love to have everyone come visit the website. We've set it up for academic articles for people to learn, also look at before and
amazing.
articles.
Please, audience, please go to this website. Amazing, amazing articles he's put on.
And it's www.drdhir.com. We have plenty of pictures for people to see. We have a blog also as well. I have a personal story about myself going through a nasal surgery and how nasal breathing helped me feel confident and move forward with my life. And so we'd love to have patients come visit us and see what we can do for you.
Well, thank you so much. He's right in the Golden Triangle of Beverly Hills. Please look him up. Thanks so much again for being on the show. And I will be back next week with amazing guests. This is NainaMD, Beverly Hills, Fusion of Science and Beauty. See you next week.